Good morning again, and welcome to my vlog, Dr. Dennis Latuno. This is part 2 of diabetes. Last time we discussed about type 2 presentation and treatment. Right now we're gonna discuss about type 1, actually different kinds of insulin and long-term complication of being a diabetic. Also, I forgot to tell you last time, for pre-diabetic, the treatment is diet and exercise, but a lot of doctors starts patient on low-dose metformin, 500 milligram BID. So for type 1, the treatment actually is insulin, and there's three kinds of insulin: the fast-acting insulin, the intermediate, and the long-acting insulin. Example of the fast-acting insulin are aspart, lispro, and glulysin. And usually the onset of action of this is fast, of course, because it's a fast-acting insulin. Usually 5 to 15 minutes, it'll act right away, and the duration ranges from 4 to 6 hours. And usually you have to give this before meals or right after meals so that you won't develop low blood sugar. And then the intermediate acting insulin is NPH. Onset of action is 1 to 2 hours and duration is 12 hours. And premix insulin is also given. Usually is NPH mixed with regular or a fast-acting insulin. And of course, the duration action, because it has an NPH, will be 12 hours. And usually give this before meals too. For long-acting insulin, there are three kinds: the Glargine, the Detemir, and the Deglutec. And usually the duration of action of this one is anywhere from 24 hours to 42 hours. And usually they have no peak, but just a baseline insulin. So, yeah, that's for type 1, you have to use insulin, you have no other choice. But for type 1, if it is not properly controlled by the usual insulin, it's better for you to consult your endocrinologist and get an insulin pump. And the long-term complication of diabetes are many. Number one is in the eyes, you develop retinopathy, and this is the leading cause of blindness in adult. So it's better that you really take control of your blood sugar so you won't develop this type of problem. Also, you need to control your blood pressure properly. Again, the goal for diabetic is less than 130/80. And number two is the diabetic nephropathy. Yeah, diabetics are prone to kidney failure, and usually the earliest presentation would be microalbuminuria, which is about greater than 300 milligram of albumin per day in the urine, of course. And again, diabetes is the leading cause of end-stage renal failure, needing hemodialysis in adults. Number three complication is polyneuropathy. First one is peripheral neuropathy, presents as numbness, tingling, burning sensation, usually in both legs. And the other one is orthostatic hypotension, meaning your blood pressure drops when you're laying down, and then suddenly stand up, your blood pressure drops and it will cause dizziness. Sometimes you passed out. And number three on the neuropathies are gastroparesis. This is a actually like a paralysis of the stomach, where your stomach does not contract properly to propel the food going into the small intestine. And usually they present with intractable or persistent nausea and vomiting. And the initial treatment for this would be Reglan 10 milligram 15 to 30 minutes before meals and at bedtime, and sometimes they use erythromycin 125 milligram QID. And number 4 on the polyneuropathy would be a neurogenic bladder, meaning your bladder also does not contract properly, so you're prone to develop urinary retention. And number 5 on the polyneuropathies would be chronic diarrhea, and usually the cause is multifactorial. Of course, if you have chronic diarrhea, then you have to take like Lomotil or Imodium to control the diarrhea. And then the number 4 long-term complication of diabetes are in your arteries. You're prone to develop coronary artery disease, which leads to heart attack and stroke, and also peripheral vascular disease, meaning poor circulation in both legs due to severe atherosclerosis. And miscellaneous cause of diabetes long-term complication, of course, for men is the erectile dysfunction, and if you don't take care of your feet because you have a neuropathy, you don't have any sensation in both of your legs, especially in your feet, you're prone to develop ulcers. So for diabetic, we ask them to check their feet all the time, and even the doctors check their feet every visit, and make sure to wear slippers, not walk barefoot at home. So those are the main complications, long-term complication of diabetes. Sa Tagalog naman, ang number 1 complication is yung sa mata, yung tinatawag na retinopathy. Ito ang number 1 cause ng pagkabulag sa adult, sa mga diabetic. So, kailangan kontrolin talaga yung inyong blood sugar, tsaka yung blood pressure. Number 2, yung kidney problem. Nagkakaroon ng damage sa kidney pagka diabetic ka. Usually, nagpe-present ng parang microscopic na albumin na dahil nadadamage yung kidney. Yun ang unang presentation. And again, to prevent yung kidney failure is to control the blood pressure properly and mag-start right away yung mga diabetic with ACE inhibitor or tinatawag na ARB like Cosar. And yung number 3 is yung neuropathy, yung sa paa o sa leg, merong yung burning sensation sa paa, parang nasusunog yung paa nyo, parang tinusok ng karayom. Yun ang isang presentation ng neuropathy. At pangalawa, yung blood pressure bumabagsak pagka galing kayong nakahiga and then tatayo, bigla kayong mahihilo dahil bumabagsak yung blood pressure nyo. Ang pang-apat, yung suka ng suka dahil yung stomach nyo, yung bituka, hindi nagko-contract properly. So, naiipon yung pagkain sa bituka. Ang kailangan dito kumain ng konting portion, like 6 times a day, para to prevent itong pagsusuka. At saka ang gamot dito yung Reglan 10 milligram 15 minutes before meals and at bedtime, tsaka sometimes antibiotic, ang pangalan erythromycin, 125 mg 4 na beses sa isang araw. At panglimang cause ng mga neuropathy is also yung diarrhea. At ang pang-apat na major long-term komplikasyon ng diabetes is pwede kayong ma-heart attack, ma-stroke, at yung circulation nyo sa paa, sa legs ay hindi maganda. So, nagkakaroon ng mga ulcer sa paa minsan dahil sa poor circulation. Kaya kailangan talagang kontrolin ang blood sugar properly at ang blood pressure. Sana meron kayong natutunan sa sinabi ko, mabilis lang pero importante ito, especially sa mga diabetic. Pagka meron pa kayong tanong or may question, message nyo lang ako or magpatingin kayo sa doktor nyo kagad. Again, this is it, folks, and I'll see you again on my next vlog. My next topic would be hypertension or high blood pressure. Okay, bye.